I'm here to talk to you today about pain and inflammation. Well, they're synonymous. Most all pain is secondary to inflammation. Inflammation is the lead cause of pain in our tissues, in our bodies. What is inflammation? Inflammation is redness, swelling, pain, discomfort, and that's caused by a release of chemicals in our tissues. Those chemicals are pro-inflammatory chemicals that our cells and tissues produce when traumatized or when irritated in some way. That can be through an infection, it can be through an autoimmune response, any immunological response, or a trauma. And there are compounds naturally occurring that can help reduce the inflammatory process. Why is this important? Well, of course, if we can reduce inflammation, we can reduce the pain associated with inflammation. But even more importantly is inflammation is the now known to be unifying theory of disease. What does that mean? It means that inflammation underlies the cause of aging, degeneration, cancer, most all disorders that we deal with. So, other than relieving just pain, we also want to improve our overall wellness and reduce our risks for cancer and degenerative disorders by reducing the inflammation in our bodies. How can we do that? The most important factor for reducing inflammation in a natural way is our diet. Eating a low inflammatory or anti-inflammatory diet. That's a diet that is very high in the intake of vegetables and fruits and whole grain products, legumes and beans. Mostly of the intake of vegetables and fruit, we want to use the colorful vegetables and fruit. So a diet very colorful. Now, those color compounds, the molecules and chemicals and compounds in the natural plant kingdom, in our fruits and vegetables, that cause the colors, the purples, the blues, the reds, the yellows, the orange, all of those color compounds mostly are flavonoids or polyphenolic flavonoid compounds. And those flavonoid compounds are very strong anti-inflammatory compounds in our bodies. And so we want to take in high levels of those, not only from our diet, but if we're suffering from a low level of inflammation due to an autoimmune process, due to cardiovascular disease or an immunological process that's gone awry, we want to take even supplemental doses of those polyphenolic flavonoid compounds. There are a number of those compounds that are known to have specific anti-inflammatory and anti-aging and anti-cancer activity. One, curcumin. Curcuminoid compounds are found in a lot of natural anti-inflammatory and pain-relieving products. Standardized curcuminoid products have been shown in the peer-reviewed medical scientific literature to reduce inflammation tremendously. Curcuminoids are one of the most studied natural compounds in the scientific arena right now because of their anti-inflammatory effects. And guess what? They're very, very safe. In some of the clinical studies, very high doses of curcuminoids were given. Not only were they found to be effective in reducing inflammation, but they're found to be non-toxic. Next are green tea polyphenol compounds, known as catechins and epigallocatechins. These are very, very important in protecting our connective tissue from inflammation, particularly the vascular and joint connective tissue. These compounds act as anti-inflammatory agents in the connective tissue. They're actually taken in to the cross-linking structures of our connective tissue, and there they act as antioxidant and anti-inflammatory compounds, reducing the breakdown of those tissues from inflammation and reducing the release of inflammatory compounds. So they're very, very important. Next is boswellia. Boswellia, also traditionally known as frankincense, is a well-known anti-inflammatory compound. It works similar to aspirin. It blocks the production of certain prostaglandin 2 compounds. These are natural cellular compounds that, when released in our system and in our tissues, cause a cascade resulting in inflammatory reactions. The boswellia blocks that production and acts as a very good anti-inflammatory compound. It's been studied in some arthritic conditions and some inflammatory bowel conditions and found to be very effective in clinical studies. I love to use products that use both the curcumin and boswellia natural products together, especially in standardized doses. Those products work really well where you're dealing with a chronic inflammatory condition. Next is a product or a molecule that you all know as aspirin, or salicylate. Now, there are numerous salicylates on the market as drugs. Many of them are used to treat inflammatory bowel disease. A number of them are used to treat very chronic arthritic and inflammatory conditions. There is a natural salicylate compound that I like to use, and I use in this office a lot, called salicin. We use the extract of the white willow that's standardized for its active anti-inflammatory capability. That, along with boswellia, along with some of these polyphenolic compounds that we talked about, these flavonoids, can be very, very helpful in lowering the inflammatory index in your tissues in your body. So, pain and inflammation. Inflammation is the unifying theory of most disease now. It underlies, as a cause, most disease processes. It results in pain, it results in degeneration and aging. Anti-inflammatory compounds from the natural world, like the curcuminoids, the polyphenolic flavonoids, boswellia, the salicylates, can be very helpful anti-inflammatory compounds. And by acting as anti-inflammatory compounds, can act in many cases, particularly in the curcumin, act as anti-cancer and anti-aging molecules.